Howdy everyone. Hope you all are at the best of your healths. It gives me immense pleasure to return back with yet another video in the removable prosthodontic series. I am grateful for the appreciation and encouragement received for my last video on posterior palatal seal area. It has now been viewed more than 1,000 times. In this video, I discuss a vital aspect in partial dentures. If you view a direct retainer of a cast partial denture, you can see a retentive, bracing, and a supporting component nicely placed together. No matter whether it is placed on a planned PFM crown or on a prepared natural tooth. Let's focus on the supporting component of a partial denture today. I'm talking about a rest approximating a prepared rest seat on the abutment tooth. Let's locate a favorable position for a rest seat on the abutment tooth. The rest seat should be placed such that it directs the functional forces along a favorable direction, which usually is along the long axis of the tooth. This direction is supposedly in an orthodontically favorable direction. Also, the PDL fibers are in a better position to absorb these forces, and in turn it itself is protected against breakdown, which is further conducive towards the health of the alveolar bone. On the other hand, a rest serves as a vertical stop for the prosthesis and disallows sinking of the denture in function. Next, a rest acts as support, especially for the retentive clasp of the direct retainer, and maintains its function in the desired position or the intended position. Here is a well-structured rest in place for you. It's a type of mesio-occlusal rest on a maxillary premolar, which has received an RPI, that's rest, proximal plate, I-bar type of direct retainer. We have to bear in mind that the rest shouldn't be an over-contoured extension of the coronal tooth structure, but an integral part of it, which means it is an intracoronal preparation on the tooth. Hence, to discuss the most pertaining topic to the clinicians in cast partial dentures, I bring you rests and rest seats in partial dentures. I am your prosthodontist, Dr. Amit Sadhwani from Mumbai, India. Today we highlight on the specifications and preparation guidelines of occlusal and the cingulum, also known as lingual rest seats. We shall also have a look at some clinical visuals and rest seats on surveyed crowns. So the rest seats are not just a part of the main abutment tooth. Indirect retainers, which are placed away from direct retainers at secondary sites, also bear a rest. Typically, canines are utilized for this purpose and have a rest on their cingula. A reliable landmark on the palatal surface is cingulum. Indirect retainers may sometimes be devoid of a retentive element but would definitely bear an auxiliary rest. Let's begin with an important consideration. In a proximo-occlusal rest on a posterior tooth, it is imperative to create a seat that is shallow and its base absolutely well-rounded like a shape of a spoon. This would make the rest and rest seat akin to a ball and socket configuration. This geometry permits dissipation of potentially harmful lateral forces on the abutment tooth. Continuing with some more desirable specifications. The floor of the rest seat should be such that the enclosed angle formed by a line dropped down the proximal surface of the tooth and the floor must be less than 90 degrees. This permits forces to be transmitted along the long axis of the abutment. Imagine a scenario not following this specification, like that between two triangular solids placed in such a manner, the angle greater than 90 degrees would lead to an inclined plane effect in such a case, leading to splitting horizontal forces during function. Now let's take a look at a tooth having a rest on it in an inclined plane. The forces would eventually lead to migration of the abutment tooth over a period of time. Even before we gear up to prepare a rest seat on an abutment tooth based on an approved design, we might need to consider preparing a guiding element on the tooth which creates a path of insertion and withdrawal for the denture. Whenever a guide plane is necessary, it precedes the rest seat preparation. The height of guide planes on proximal surfaces are usually longer in a tooth-bound scenario than in a case of a free end saddle. When we discuss the gross outline of a mesio or a disto-occlusal rest seat, it should be roughly triangular, with the base of the triangle located at the marginal ridge and the rounded apex directed towards the center of the occlusal surface. Preparation is accomplished using special tapered rounded burrs to avoid any undercuts within the preparation. A finishing burr should be the end point of such preparations, which can guarantee smooth finish to avoid plaque adhering surfaces on a natural tooth. Do we have any measurements with us? Of course, we do have some guidelines. If x is the mesiodistal width of the premolar, the dimension of the rest seat should be somewhere around one third to one half of x. In case of molars where the mesiodistal width is more, it usually restricts itself to about one third. Speaking about the buccolingual specifics, the rest seats should routinely take up half the distance of the intercuspal width of the posterior abutment tooth in general. Now, there are times when rests are joined together along adjacent abutment teeth. These lie within the occlusal embrasures of adjacent teeth and rest upon a MO and a DO seat prepared together. The embrasure rest seats should be sufficiently deep and adequately wide, especially at the facial and lingual embrasures. Lack of preparation, my dear friends, usually fractures this type of rest in function. Care should be taken not to break the contact between the tooth completely, which may otherwise lead to migration of tooth or food impaction. A slightly wider, tapered rounded burr is the best to achieve success in this preparation. To verify the depth, place two 18 gauge orthodontic wires within the preparation. The patient should be able to bite without any interference. Let's move on to anterior teeth, where while looking for a dependable tooth morphology, we reach the palatal surfaces of anteriors. Amongst the anteriors, the cingulum of canine is the most reliable structure to transfer the forces axially along the tooth. The shape of cingulum rest seat is more or less like a crescent. The mesiodistal width is about 2.5 to 3 mm, depending upon the size of the tooth, and buccopalatally, it thins down to about 2 millimeters. An adequate depth for the preparation should be about 1.5 millimeters. This is how the rest looks from the proximal surface. The reason why an incisal rest is not preferred in anteriors is because the distance of cingulum till the center of rotation of the tooth is lesser than that of the incisal edge. The lesser the better, as a higher magnitude of force would then be required to tip the tooth at cingulum, thus protecting it longer. A cross section of the cingulum rest seat shows a V-shaped valley without any sharp edges. The burrs typically used for creating the seat should be similar to an inverted cone with or without sharp defined edges. Always remember to smoothen out the preps with a finer grit diamond of a similar shape. I have a link for the set of burrs which can be used for preparation in the description box. Do check it out. An intraoral photograph shows the extent of the rest seat on a canine, spanning on the palatal surface like a crescent. Look at the extent, with the edges narrowing out gradually as we move away from the center. With the lower anteriors, the issue arises because of a lack of tooth structure lingually and a more or less ill-defined cingula on the incisors and canines alike. A modification which may be adopted in such cases is building up the lingual surface with some composite, whereby the metal extension would then wrap in like a hook and direct the forces along the long axis of the anterior tooth and avoiding sinking of the denture. Not only this, but also the distal movement of the free end saddle can be prevented with this feature. In many instances, a surveyed cast crown or a bridge is a part of the whole treatment plan along with the cast partial denture. The rest seats in such cases need to be carved out on the crown, and the area in contact with the rest should be a polished metal island. No matter even if it is a mesio or a disto-occlusal rest seat or an embrasure rest seat with a little more leeway for the interdental minor connector for that matter. Such rests aren't decided overnight, but are a part of a broader, more systematic approach towards the plan. The metal concavities need to be carved out during the wax pattern stage of the restoration itself, like here, which of course is a result of a CPD design brought in with an elaborate discussion between the clinician and the technician. And this is the final result with the rests perfectly seating on the prepared areas. After browsing through some literature, I came across possibilities of creating rest seats on surveyed all ceramic crowns. It is found that monolithic cad-milled zirconia crowns can be used as rest seats for a cobalt chromium cast partial denture, provided the rest seats created are more wider than normally followed and any sharp edges are completely avoided. So I decided to utilize it for a patient receiving a full mouth rehabilitation. The rest seats were designed on a CAD software and the crowns milled. Absolutely free flowing rest seats were made for canines and the molar. Care was taken that no veneering ceramic was used for the areas receiving the framework extensions. This is how the final result looked like with the cast partial denture in place. Time for some troubleshooting. This partial denture was given about a couple of years ago. A PFM crown was given on tooth 1-5 after its endodontic treatment. A disto-occlusal rest seat was created on 1-4. The status after 2 years was a grossly decayed first premolar. Such incidences are a common sight if the patient is not compliant with oral hygiene measures. It is also due to the inherent nature of the preparations which leave vital tooth structure exposed. Constant hygiene reinforcement is a must, and as far as possible, the preparations should be confined within the enamel which may reduce the chances of caries. It is the operator's duty to use the best of polishing measures available after preparation. With many choices around, the best result can be achieved with armamentarium that best suits the hands of the operating dentist. I hope you have enjoyed this video. Please like, share, and subscribe to my YouTube channel called Dr. Amit Sadhwani, MDS Prosthodontics. Also, check out and follow my new Instagram, Care Dentures. If you have any suggestions or any feedback on future episodes in the series, do write to me on my email address or connect with me on my number. Until next time, everyone, stay safe, stay secured, and maintain hygiene. See ya.